Hello, my name is Brittany Aramo, and I'm going to be completing my presentation for the role of nurse practitioners and how they differ from other professionals in the workplace. More formal definition for a nurse practitioner includes language that addresses a responsibility and accountability for health promotion and the assessment, diagnosis, and management of patient problems. And these can also include the use and prescription of pharmacological and non pharmacological interventions for a patient. This also includes having the nurse practitioner complete an accredited graduate level education program in order to be prepared for the APRN role. Passing a national certification exam is also a requirement, as well as acquiring advanced clinical knowledge and skills. Preparing the provider with direct patient contact is another important crucial role. Obtaining specific licensure is also crucial in any and all states that a nurse practitioner practices in, and also to break down into the group of nurse practitioner, which includes certified registered nurse anesthetist, certified nurse midwives, clinical nurse specialists, or certified nurse practitioners. Advanced nurse practitioners are also able to assess, diagnose, order diagnostic laboratory, as well as prescription medications for patients, as well as evaluate how treatment plans and options are working for patients and making those care plan changes with their patients directly. Oftentimes, depending on your state, this is done under the supervision of a medical doctor, but in other states, once enough clinical hours under the supervision of a doctor, or the state allows for independent practice by nurse practitioners. There are differences between nurse practitioners, physician's assistants, and doctors. The nurse practitioner we already had discussed. For physician's assistants, they require much more schooling and clinical hours in a variety of clinical settings, inpatient, outpatient, surgical, and a wide variety of other specialties. Whereas nurse practitioners generally are functioning in the primary care setting, whether with adult, geriatric, or pediatric patients. They can also specialize in mental health as well as nurse midwifery in order to be able to assist with births. Nurse practitioners are generally studying and trained within a specific demographic of age for patients, being neonatal, pediatric, adult, or geriatrics, where physician's assistants are trained from the entire life spectrum, making them much more versatile in what their specialty will be. PAs also require 2,000 clinical hours of training, whereas nurse practitioners require the 1,000 hours of training, but both do require obtaining a master's or furthered educational degree. Physician's assistants have only one certifying body, where nurse practitioners have 6 certifying bodies from which that they can choose from, meaning that generally it is more difficult to jump from specialty to specialty as a nurse practitioner, where physician's assistants are trained more holistically in the whole realm of all different specialties, and it is easier for them to transfer from one specialty to another. The primary difference between nurse practitioners and physicians is that nurse practitioners are trained in the advanced practice of nursing, and physicians are trained and educated in general practicing of medicine. Now, why don't I just become a physician? Becoming a nurse practitioner, I believe through direct experience in work and personal life, give a much more comprehensive and in-depth connection in any kind of a setting where they have to assess a patient and take care of them. They have often shown that nurse practitioners have a lot more bedside manner because generally we've all been practicing with patients, whether in home care, long term care, acute care settings, or in the outpatient clinic settings. We are generally better at communicating with patients and establishing a feeling of trust with them and coming down to their level. Whereas physicians are generally trained in memorizing lots of information and being able to practice medicine, it doesn't leave a lot of opportunity and time for them to learn the importance of establishing those connections with their patients and making them feel very comfortable, like they can open up and talk to them. That's why I would much rather become a nurse practitioner rather than a physician. So that way I can continue to be a wonderful resource for my patients and one that they are comfortable to reach out to in case they're having any problems or having signs and symptoms of issues that need to be addressed. Thank you.